Hello, today I'm going to give you a brief overview of what PRN medication is, why and when it is useful, and give an example of how it might be used in healthcare practice. PRN is an abbreviation for the Latin term pro re nata, which means as required. If we talk about PRN medication being used within a hospital setting, for example, a prescriber would document on the Cardex the medication name, the indication as to why it will be given, the dosage, frequency, and the maximum dose within a 24-hour period. Let's use the example of paracetamol to fill out this example Cardex. So the medication, we would be writing paracetamol. Route is oral. We would have to make sure there's a start date, but we can leave the end date blank for the time being because it doesn't specifically need to have an end date. Dose is 1 gram. Frequency every 4 hours, so 4 hourly. Indication would be for pain. With paracetamol as well, it could also be for fever, for example. The maximum dose within a 24-hour period would be 4 grams. And as with any other medication, we would need to make sure that the Cardex is signed for by the prescriber. The reason pain relief is commonly prescribed as PRN medication as opposed to regular medication, given at a set dose at a specific times, is because pain can fluctuate and therefore patients could need this medication at different times of the day, or they might not need it at all. But the benefit of PRN is that it is an option as required. This is just one simple example of how PRN could be used, but it can also be used and is really useful in healthcare settings where there isn't a prescriber on site at all times, such as a care home or a nurse-led unit. Thank you very much for watching today.